So what we are doing today is to look at the challenges and limitations of digital dentistry as we have done. So we have initially looked at what is digital dentistry, the introduction. We have looked at the core technologies in digital dentistry. We have also looked at the application of digital dentistry in dental specialties, and we did look at the benefits of digital dentistry, I believe. Now we are looking at the challenges as well as the limitations that are associated with digital dentistry. So the aim of this session today is to do that. However, the learning outcome today, what I want to see at the end of this session is that you should be able to recall and remember the benefits of digital dentistry, and that you should be able to understand and explain the challenges and the limitations of digital dentistry, as well as engage in meaningful brainstorming conversations and explorations of the future of digital dentistry, especially in the application of digital dentistry to your own field. So to the practice of dental technology, to the practice of dental therapy, to the practice of orthodontics, endodontics, whatever your own area of specialty is. I wanted to imagine and try to brainstorm around the possible feature of digital dentistry in your own clinical practice. So I've broken the session down into different segments. We will be looking at recapping on what we did previously. We'll try to introduce reintroduce the benefits of digital dentistry, and then we'll move on to looking at the challenges and limitations of digital dentistry. We'll have some impact and applications of digital dentistry in clinical practice. We'll look at in-class activity, so we'll do some of group learning, and then we'll try to do the future of digital dentistry. Okay, so let's do a bit of a recap on the things that we have covered previously. So what I want you to do now, unfortunately I cannot take you into breakout rooms, but what I want you to do now is to explain one advantage each person of digital dentistry. Okay, one benefit of digital dentistry. This is from what we discussed previously. So can you remember and explain one benefit or one advantage of digital dentistry? Possibly with example. You can make notes, you can jot it down, and also you can take notes when someone else is trying to explain. One benefit of digital dentistry. The computer-aided design and the computer-aided manufacture. Okay. Thank you very much. So you said that the computer-aided design and the computer-aided manufacturing helps to produce dental prosthetics faster and more efficiently than the traditional method of doing that. So that is one benefit of the applications of digital dentistry in dental technology practice. Can anyone give us another benefit or advantage of the application of digital dentistry? Anyone else? Good morning, Uchama. Intraoral scanners, okay. Okay, thank you so much. So that was about intraoral scanners. Okay, iOS. So the use of iOS in dentistry makes the job easier in terms of, getting a 3D image of the oral cavity, the dental uh, arch of the patient, the upper and the lower arch of the patient. It is better done that way than the traditional use of impression trays and alginate to take impression of the patient mouth, and it is more comfortable for the patient as well. The patient don't have to go through that process of, ridiculously trying not to gag and all the disgusting part of taking impression. So what you're saying is that one advantage of digital dentistry that you can remember is that it helps you, that the use of intraoral scanner is very efficient, better than the traditional impression taking techniques. Thank you for that. Does anyone else want to contribute something? Justin? Yeah. Thank you. That is a very important example that you've used there. Eco-friendliness. Okay, so there is a lot of eco-friendliness that we benefit from the use of digital dentistry. So, for example, when you think about the production of uh, a dental model, for example, in the dental laboratory, there are so many materials that go into the process of trying to produce a dental model. However, when you replace that with the digital dentistry, then you eliminate all of those wastage that go back to the environment and mess the environment up. They are all done digitally, and then the environment does not have to suffer the consequence of producing a mouth model for one person. So yes, eco-friendliness is one important advantage of digital dentistry. Anyone else? Yeah, Hillary. Yes, thank you, Hilary. So yes, teledentistry, which is another application of digital dentistry, have made it easier for uh, communication between the patients and the clinicians without the physical travel, and it has made it easier to take dentistry to rural communities where the travel would have hindered that outreach. So yes, you are completely right. Teledentistry has revolutionized how we use practice dentistry. We can now reach more people without making physical travel and physical journey to go to places for basic things like consultations and follow up of patient care and all of that. So yes, you're right. I've got Yakin, Yakin. Yakin, are you there? Yes, please. Eh, Okay, thank you. So the application of AI in dental practice has also helped things to get so much better. We can do certain things now, do diagnosis with a lot of precision, so we can be sure that the accuracy of our diagnostic accuracy is top notch. We can also use digital dentistry to map out sites for operation or for implantation of dental implants and all of that with minimal errors, or perhaps with errors eliminated, as the case may be. Technologies are very important and they are very lovely when they work properly. However, there are times when they do not work properly, which are the things that we will be looking at today. Okay, today we are going to look at when technology does not work properly, what is going to happen with our almighty digital dentistry. Messi, do you want to make a contribution? Yes, Messi. Yes, thank you so much. So, still on eco-friendliness, the use of electronic patient management system, electronic patient records, has eliminated the liability and the trouble of carrying so much paper. And we know where our papers do come from. The papers that we consume in dental practices all come from deforestation. So it is when deforestation happens that those trees are used to manufacture the papers that we use in our dental practices. So when we go digital with our patient record, we go digital with our appointment system, we minimize the level of papers that we use. That is one aspect, eco-friendliness. The other aspect is that it enhances our ability to actually recover the record of our patients, our treatment plannings, our treatment plans, and all of that can be recovered in case of any disasters. For instance, if any practice is engulfed with fire and you have to escape to another place and there is nothing coming out of that unit with you, if you have a second clinic where you can move your patients to, you will be able to, download again the patient information if you are running a cloud-based patient record management, so you can download them from anywhere, and that will help your practice to continue to move forward while you sort out the natural disaster that you have just experienced. Okay, so that is a very good example. Eco-friendliness as well as uh, ability to recover lost or uh, damaged records in case of any disaster. Finally, let's hear from Pauline. Good morning. Okay, thank you so much. Yes, so in terms of, yeah, Yes, in terms of patient education, which is in line again with teledentistry, in terms of patient education, we can actually make an improvement using digital dentistry where you can the patient can visualize the treatment plan, the patient can visualize the potential outcome of the treatment, the patient can visualize, you know, what their smile will look like if you are doing a smile design and all of that. So the patient will understand better when they can see what you are discussing with them, as against if they have to just make mental pictures of what you are saying. So in traditional dental practice, you can only explain to a patient who we already know is not going to have a good understanding of what we are explaining, because they are not seeing the explanation that we are giving. But with digital dentistry, you can actually help the patient to visualize their oral cavity before you do the treatment, showing them where the problem is and what you intend to do. You can digitally design a smile for the patient, and they can preview that. So all those education and patient interaction is significantly enhanced with digital dentistry. Okay, so having discussed these issues, now what I would like us to do is to look at a bit of what we did last week. So some of the things that we looked at as the benefits of digital dentistry include enhanced accuracy and precision, and one of you did actually mention that. We said that digital dentistry improves patient experience. Okay, it improves patient experience. There is time efficiency and reduced chair time. Okay, so it helps us to be efficient with our time, and also minimizes the length of time that a patient will have to sit down. There is better communication and collaboration between the patient and the clinician, and between the clinicians and other clinicians. There is better communication and collaboration. There is increased predictability and treatment outcomes as well. So it increases the predictability of the treatment outcome. There is sustainability and environmental benefits. Also, we talked about that. And there is seamless data management and storage. We've talked about that it helps us to manage data and also recover data when there is need for that. Personalized and patient-centered care, again, that goes in line with the patient education that we're talking about. So when the patient can visualize what you want to do, and you can plan and personalize that treatment for that particular patient, and it will not sound very vague to the patient, because you are now making the patient to actually see the treatment that you are trying to offer them. It enhances business growth and competitive advantages. Okay, so your business is, going to grow because you are saving time, you are saving resources, and all of that. So you will, grow in the business. That is also opportunity for continuing education and skills development. So digital dentistry give the clinicians an opportunity to grow in their skills and advance in their skills. So what I want to do now is to go a step further, for us to specifically look at, just as this is like a revision, for us to specifically look at the enhanced accuracy and precision. Okay, so we'll look at one advantage, and then so the question here is, how does digital dentistry enhance accuracy and precision? Okay, how does it enhance accuracy and precision? Can someone tell us, how do you think digital dentistry can enhance accuracy and precision in dental practice? Messi, yes. Thank you so much. That's quite detailed. So with the use of digital dentistry, we can enhance accuracy and precision. And one example is the use of intraoral scanners, which shows you all the dimensions of the teeth, the anatomical features in perfect shape, exactly the way they are, so that it will be reproduced in a perfect way instead of manually taking impression, which may not come out as accurate as it is. And even the process of reproduction of that impression, one of you had said previously, someone did say previously that even when one person takes impression twice, cast an impression twice, that prosthetic might not be very identical to each other. There might be some significant changes in the features of the work that has been produced by the same person using the same impression. So but when we employ digital dentistry, it gives us that level of accuracy, it gives us that level of precision in the production of any impression or production of any prosthetic device that we have taken intraorally using the intraoral scanners. And you also did say that the computer-aided designs and the computer-aided manufacturing system helps us to actually design the work visually instead of manually designing it in a dental laboratory. We can design the work visually and the outcome will be as accurate as the visual design, instead of trying to navigate the design manually, as some of us are still doing in our dental practices and dental laboratories. Okay. Did I see someone else wanting to say something? Okay. Yes, please. Go on. Good morning. Okay. Yeah, thank you. So digital radiographs can enhance precision and accuracy in orthodontic treatments. So you can use digital radiograph to visualize the occlusal margins, to visualize the malalignment, the malformation of the teeth, and you can use that to accurately see and analyze the direction of movement of the teeth when you are trying to adjust them to put them in a perfect position. So digital radiographs in the treatment planning, the use of digital radiographs in the treatment planning, orthodontic treatment planning, will enhance accuracy and precision. Thank you so much. So if we move forward from there, just to finish that part of what we are doing today. So we said, how does digital dentistry enhance accuracy and precision? One example is the use of intraoral scanners, which can capture fine details which traditional impressions may miss when you are doing your practice, when you are treating a patient. Also, the use of the CAD/CAM, the computer-aided design and the computer-aided manufacturing system, will ensure that restorations will match the tooth margins and occlusal surfaces perfectly. Okay, so when you use the CADs and the CAMs to design your job, then you can get a perfect occlusal, perfect occlusion, as well as the margins of the teeth will be as accurate as you want it to be. That is another example of how digital dentistry can enhance accuracy and precision. Also, the use of CBCT we provide a 3D volumetric analysis and eliminating guesswork in implant planning and endodontic planning. So we talked about the use of CBCT. You get the 3D image of the patient's jaw, the patient's mouth, and then that can help you to precisely point out, having examined and analyzed the bone density of the patient, the nerves, and all the structures around the mouth, then you can be able to place your implant with high level of precision, which minimizes error and implant failures, as well as in endodontic treatment when you are trying to trace the nerves and trying to trace the root canal and all of that. Then you can be able to use digital dentistry to actually the CBCT can be used to map out the actual line of your drilling in endodontic treatment, and that will actually help and enhance accuracy and precision. So what I want us to do now is to